across the country. Overdoses of heroin. In many states, it's responsible for more deaths than traffic accidents.
And there is a drug to help stop an overdose. Last night during our 5 p.m. show, our Paul Wagner showed us how the drug is administered.
You can also do it intravenously. Show me how that works.
Absolutely. It's almost the same exact procedure. The only other thing we have to add is putting a IV into somebody's arm or into some other vein that we can find. Pull off our caps. And we have the port on the IV. And all we have to do is inject the drug right inside of the port. And that is going directly into the vein and into the heart and hopefully to reverse the narcotic overdose.
But sometimes communities have trouble getting access to that drug. One lawmaker in our area is trying to change that. Fox 5's Melanie Alnwick is live now on Capitol Hill with more on this plan. I guess the end game or ultimately the plan is to save lives. Mel, good morning.
That's right, Stephen Allison, and saving lives is so critical, and there's really just a very, very short window in order to do it, and that is why this drug, Naloxone, is so important, medical professionals believe, to get into the hands of first responders. So not only are we seeing EMTs having it, we're also seeing, as you just saw in Paul's piece as well, local police departments having access to this drug, and we're trying to get it to even more people because it can actually reverse the effects of the overdose in literally just seconds. Someone who is near death, quick administration of this drug, they can be up and walking and better in just a few minutes. And that is why they really are trying to increase access. And one of the people spearheading that is Virginia Senator Tim Kaine. Thank you for joining us this morning.
Yeah, Melanie, great. Glad to talk about this.
How big is the problem in Virginia?
Very big. We last year, and we're on track again this year, to have more overdose deaths than auto accident deaths, which is just kind of incredible. And the big increase in drug overdose deaths has been heroin and then these prescription opioids that have the same effect as heroin. And we're seeing it all over the state. I first kind of learned about it in trips in the coalfield communities in Appalachia, but Winchester in Northern Virginia is one of the centers of a lot of overdose deaths. We see it in Fairfax and Arlington. There's no part of the state, and frankly, there's no state that has been spared this significant challenge.
Yeah, and it's interesting that it's not the typical addict who is taking this. I mean, we're talking about women, we're talking about high-income professionals.
Yep. And it's kind of a mixture of people. There are people who use, these prescription painkillers, kind of in what you might think of as they're trying to abuse drugs. But a lot of people, they get a prescription because they have a pain issue. Maybe they had a chronic injury at work or something like that. And then they start using the medicine, and it's so powerful they get addicted. Once your body accustoms to it, it doesn't have the same effect. So maybe you're supposed to take one every 6 hours, but after 4 hours the pain comes back, and people think, okay, well, the pain's coming back, so the drugs are off. I can take another one. Well, the cumulative effect builds up, and then what happens is it leads you into respiratory failure. And that's what the Naloxone does so well. It brings you back from the respiratory failure that is the cause of overdose deaths in this situation. And the thing that's pretty interesting about it is if you're not undergoing an overdose, it doesn't have a negative consequence. So first responders carry this, and they'll see somebody that might be in respiratory failure. They don't know the cause. They'll administer naloxone right away, bring somebody back and save their life. But if it turns out something else is wrong, the naloxone administration doesn't make that worse. So in this sense, it's a really powerful and positive medication.
So why do we need your legislation that would sort of set a standard that physicians would prescribe the antidote along with the painkiller? Why do we need that?
Here's what's been happening, Melanie. The way naloxone has been used, and you talked about it as you introduced it, it's been used kind of rarely, and then now first responders use it, first responders and police use it. But so often, people go into an overdose, and before the first responder or police even get there, they have died or they can't be saved. Why not put it in the hand of the patient, him or herself, or family members who could then administer it immediately? It's very easy to administer. I took a training about a year ago in communities where folks were being trained, just like you get trained Heimlich maneuver, how to administer naloxone. You can do it through a nasal spray. You can do it through an injection. There's now an auto-injectable that's kind of like an EpiPen that you would carry if you had an allergy. And so the idea is at the federal level, in DOD hospitals, VA hospitals, federally regulated health centers, which are all over the country, set up guidelines so that if a doctor is prescribing an opioid to somebody and they meet certain risk criteria, just go ahead and give them naloxone right at the same time so they can have it in the shelf, and they or their family members can act even before the first responder can get to their house.
Sadly, we've run out of time, but real quickly, can you tell me how much is this going to cost, and how where do we go from here?
The federal portion of it's not going to have a cost. They're going to set up guidelines for co-prescriptions, and then folks will be able to recover that. There will as you prescribe naloxone, there will be a small cost to that. But also, what we are doing is establishing a grant program to encourage states to develop guidelines that would be similar to the guidelines. So obviously, if you're giving more people naloxone, there's a cost to that. But if you're saving lives, this is a drug that really works. The more people that have it, the fewer folks will die of these overdoses.
All right, Senator Tim Kaine, more to come on this for sure.
Absolutely.
Thank you so much for your time this morning.
Glad to.
Stephen Allison.